Now for our nausea medications, we have ondansetron, brand name is Zofran, given for nausea and vomiting. And it works by blocking serotonin receptors to decrease the nausea. So the big key point here is that it can cause serotonin syndrome, which is a high risk for injury. Now, a big side effect is headache and dizziness, and according to the HESI, a priority side effect is torsades de pointes, basically a really deadly heart rhythm. But to be honest, that was the only question in all the quiz banks that ever touched on this side effect. Now, a big key point, we give it before going to chemo and before or with pain medications, which can cause nausea. Guys, we don't want to play catch up. So the ATI question was ondansetron used to decrease nausea and vomiting caused by chemo, and a HESI question asked about a chemotherapy scenario. So during the infusion, a child reports nausea and vomiting. So the priority nursing action is to stop the chemo, flush the line, and administer ondansetron. Now, metoclopramide, brand name is Reglan, given for nausea and vomiting, but also for delayed gastric emptying, called gastroparesis. Now, guys, it works by accelerating gastric emptying by increasing intestinal motility. Basically, it gets food out of the stomach very quickly. And according to the HESI, it's contraindicated for clients with a bleed in the GI. For example, a duodenal ulcer or a duodenal ulcer. Now, the key point is the side effects, the extrapyramidal side effects, guys, specifically tardive dyskinesia, especially in older adults. So key point is that we question a prescription or order and we report to the HCP immediately. So guys, keywords to write down: lip smacking, sucking lip motion. Guys, this was mentioned multiple times on various quiz banks. Also, puffing of the cheeks and excess blinking of the eyes, even protruding and twisting of the tongue and chewing movement. So the memory trick is M for metoclopramide and M for major lip smacking and puffing of the cheeks. We always report the funky face movements, guys. Now, some common side effects and some common distractors. Guys, we do not need to report these. So sedation, fatigue, and restlessness, that's pretty normal. Headache was mentioned twice on different quiz banks. Guys, it's okay. We do not hold for this complication. Also, sleeplessness and dry mouth and constipation and even diarrhea. No, you do not hold the dose because it's easily treated. Now for constipation, we have laxatives and stool softeners. And to be honest, it's not a huge topic on the NCLEX review. But the big key point here is safety. So guys, it's contraindicated for bowel obstruction. Huge risk for death. So first on the list is psyllium husk, which is a bulking fiber. Second is magnesium hydroxide. Brand name is milk of mag or milk of magnesia. Now this is considered a laxative and antacid, which we'll be covering in the antacid section. Now third is sodium docusate. Brand name is Colase. Basically it's a stool softener. So it increases water content in the stool to soften those hard bowels. Now this was the only one to come up on 5 quiz banks as a direct question. So that's honestly all you'll need to know. And lastly, we always teach patients to increase their fluid, their fiber, and their walking to increase peristalsis, basically to get the bowel tubes moving. Now lactulose, we call lactulose, since it loosens the bowels to lower the ammonia levels. So we use the acronym LAC for lactulose. L for a laxative, A for ammonia levels that should be decreasing, and C for the cognition that returns. So keyword here is improved mental status. Now it's given to decrease ammonia levels in cirrhosis patients. It treats hepatic encephalopathy, fancy words for a cloudy brain, that decreased mental status from those high levels of ammonia. So guys, lactulose helps the body poo out all that ammonia. Basically, massive explosive diarrhea. So just think lactulose, we lose that ammonia. Now some common distractors on the NCLEX. Ammonia levels decrease via the bowel. Guys, not the urine, since it's not a diuretic. So no renal excretion of ammonia. And no, it does not decrease portal hypertension. And no, guys, abdominal distension will not improve with lactulose. Again, it helps us lose the ammonia in lactulose via those loose bowels. Now, how does a nurse evaluate the effectiveness? Guys, write down these key points here. Number 1, 2 to 3 soft stools per day. Number 2, ammonia levels are decreasing, but here is the key term. Write this down. Cognition must be improving. So we must have improved mental status. Guys, the biggest test tip I can give you here is don't let the NCLEX trick you. Diarrhea and loose stools are not indicators that ammonia levels are decreasing. The only indicator here is improved mental status. That's how you know the drug is working. Now for sodium polystyrene sulfonate, the brand name is K-exalate, given for hyperkalemia, that high potassium. So guys, just think K-exalate helps the K to exit the body, from the body into the potty. Now for administration, PO is the most effective, or we can also use an enema as well. Now the big key points here for patient teaching. Keywords: it helps the large intestine to remove excess potassium within the body. Most commonly chosen distractors here is, guys, no contrast is used during administration, and it's not used for bedridden clients who are constipated. That would be a Fleet's enema. And no, it does not decrease bacteria within the intestine. That would be a neomycin enema. Guys, again, it decreases the excess K. So K-exalate, it exits the body. Now for nursing care, we ensure normal bowel function prior to administration to prevent intestinal necrosis. So big key points, guys. We assess, always assessing first as a nurse. We're assessing the abdomen here. And for recent bowel patterns and frequency of stools, basically assessing those bowel function. Now, how do we evaluate the effectiveness? Well, potassium will be within normal limits between 3.5 and 5.0. Now, some textbooks say 5.5, but according to the NCLEX, they use 5.0. So guys, don't get tricked. We're not evaluating the effect of creatinine, phosphate, or calcium here. Now, some other stuff that's nice to know, but not necessarily a need to know. We monitor for signs and symptoms of hypokalemia, that low potassium, since K is exiting the body. So guys, remember, potassium helps the muscles pump. So low potassium, we get low pumps. So in the heart, we get palpitations and flat T waves. And guys, in the muscles, we just feel lethargy and cramping. But here's the key point. Not a priority before assessing bowel function. Guys, bowel function is always the number one assessment here. And lastly, ensure close access to the bathroom due to frequent loose stools at the beginning of therapy. And always assist to the bathroom. But again here, guys, the big priority is assessing bowel function. Now, according to the HESI here, we always encourage the patient to drink fluids after administration. Now for everyone's favorite topic, antidiarrheals. That's right. We're talking about loperamide. Brand name is Imodium, given for active diarrhea to decrease the motility or movement of the intestines and also increase the absorption of sodium and water. Now, according to the HESI, loperamide was the opioid antidiarrheal agent. So guys, yes, you heard correctly. It's an opioid, like a pain med opioid, that makes things low and slow with those opioids. So it makes sense that it makes the bowels low and slow too. Now the biggest side effect here is that constipation, slowing things down too well. And now we stop the GI tract entirely. Now lastly, a little funny side note about this is that the FDA had to restrict Imodium due to the opioid crisis. Apparently, patients were taking all this antidiarrheal trying to get high on this medication instead of using methadone to wean off. Now, our second antidiarrheal is dicyclamine, given to patients with irritable bowel syndrome, that IBS, who can have up to 20 loose stools per day. So think dicyclamine helps to get the bowels on a regular cycle. Now, Now, guys, be cautious with the sound-alike drug doxycycline or tetracycline, which is an antibiotic for acne. But guys, this ends in cycling like cycling a bike and not dicyclomine. So just be careful. Now, the mechanism of action is quite simple here. It's antispasmodic and anticholinergic. It basically relaxes and dries the bowel. So, big side effect is constipation, dry mouth, and urinary retention. So, for dicyclamine, just think a dry cycle on me bowels. You can't see, you can't spit, and you can't poop. Now, guys, it dries everything up, so diarrhea is not a common side effect. Remember, dicyclamine dries. Guys, it's prescribed to stop the diarrhea. So a big distractor on sub-quiz banks was that diarrhea as a side effect. So just know it's treating diarrhea. Now, a big key point here is for patient safety. Basically, which patients to avoid. So it's not for paralytic ileus or a bowel obstruction. Guys, this was the most stressed contraindication on most quiz banks. So we always question the prescription or doctor's order for dicyclamine and paralytic ileus. And it's not for narrowed angle glaucoma, but cataracts are okay. And not for a full bladder, basically anything over 400 mLs, known as urinary retention. That's always a tricky test question. So once again, dicyclamine, think dry cycle. Can't see, can't pee, can't spit, and can't shh. So guys, no peeing, so not on a full bladder. No seeing, so not for a glaucoma, but again, cataracts are okay. And no spit and poop. So watch for those stopped bowels. Keywords, bowel obstruction and paralytic ileus. So the bowel can die if you give dicyclamine. Now, sulfasalazine is a sulfa drug, guys, given for inflammatory bowel disease, IBD, including both Crohn's disease and ulcerative colitis. Those autoimmune diseases where the body is attacking itself. So this med decreases colon inflammation by inhibiting prostaglandins, which I call our party poppers of inflammation, usually from an immune response. So it's considered an immunosuppressive med that weakens the body immune system to help the body stop attacking itself. Now, common side effects, guys, these are normal. So we have yellow-orange discoloration of the skin and urine. No need to follow up and no need to stop taking the med. Now, major adverse effects for patient safety. And again, NCLEX always concerns itself with patient safety. Key points here are sulf. S for sun-dried. Sunblock and a dry body, guys. So for sun, key term is photosensitivity. Teach patients to wear sunblock and avoid direct sun exposure. And since sulfas really dry out the body, they create urine crystals, or basically kidney stones, and L, low urine output with high specific gravity, over 1.030. That was a huge NCLEX tip, guys. Write that down. Elevated urine specific gravity. So remember, if urine gravity is high, then the body is dry. So remember F for fluid and folic acid. We drink 8 glasses of water per day, and you take a folic acid supplement, 1 milligram per day. Now, don't let the NCLEX trick you. Some expected findings with ulcerative colitis, we get bloody diarrhea, and inflammatory markers will be elevated. So guys, don't stop the med. The med will actually help with this. Now, according to Kaplan, this medication, we continue even after symptoms subside. And on the HESI, it was contraindicated in patients with a sulfa allergy. Guys, write that down. This is a sulfa drug. Now for the drugs that reduce acid and prevent ulcers. The number one goal here is to protect the GI from its own acid. So number one, to tone down acid volume, we use antacids, H2 blockers, and PPIs. And number two, to protect the lining from those holes or peptic ulcers, we use mucosal protectants. The name for this is sucralfate. Now a quick recap on the key terms here. Guys, gastritis is an irritation of the stomach. GERD is gastroesophageal reflux. Just fancy words for heartburn, acid reflux that irritates the esophagus. And ulcers are all about breaking in the lining. We're talking holes and open sores. So a stomach ulcer, we call it gastric ulcer or a peptic ulcer. And for small intestines, we call it a duodenal ulcer or a duodenal ulcer. Basically, the duodenum inside the small intestine. Now, antacids are used for fast, immediate relief. So think anti-mixing for antacids. They're never to be taken with other meds. Probably the biggest test topic I can cover right here. Now, it works by immediately neutralizing stomach acid. But the bad news here is that it doesn't last long. So the acronym we use is SCAM. Like you kind of got scammed from the short duration of the med. So S for sodium bicarbonate, brand name is Alka-Seltzer. C is for calcium carbonate, brand name Tums and Rolaids. A for aluminum hydroxide, and M for magnesium hydroxide. Brand name is Milk of Magnesia. Now that's also a laxative as well as an antacid here. Now guys, the big side effects can vary on the type of antacid. So for aluminum or calcium, they can constrict and cause constipation. And magnesium can mellow out the GI tract, causing diarrhea. Now on the HESI, there was an exam question about magnesium hydroxide. And it said it can upset the stomach and cause liquid bowel movements. So write that one down, guys. Now the key point here and the memory trick, again, really stressing it here, antacids are anti-mixing with other meds. Basically blocks the absorption of a lot of medication. So the key point, never taken with other meds. Always 1 hour before or 1 hour after other meds. And guys, it's not for heart failure patients. Nothing OTC are for heart failure patients or over-the-counter drugs. All these things contain sodium, which swells the body. Now, next up is our long-lasting relief, the H2 blockers, histamine 2 receptor antagonist. Fancy words for turns down the volume of acid production. Now, these end in tidine. So, ranitidine, brand name is Zantac, and famotidine, brand name is Pepcid. Now, the key point is we take 30 minutes before the meals. So think tidine, you take 30 minutes before you go to dine with tidines. So guys, it's given for GERD and ulcers, both duodenal and gastric. And it works by reducing those gastric secretions by blocking H2 receptors in the stomach. And a big patient education here. We do not overeat, no stress, or basically stress reduction, no smoking, and no NSAIDs, which leads to GI bleeding. Now for the famous PPIs, the proton pump inhibitors, ending in prazole, like omeprazole, brand name Prilosec, or esomeprazole, brand name Nexium, and the famous pantoprazole, brand name Protonix. Now the key points are the 3 P's of prazoles. P for prevents holes. So guys, a key word here is stress ulcer prophylaxis. P for porous bones. So we get regular bone density tests. And P for possible C. diff or Clostridium difficile infection. So guys, the indication here is for heartburn and GERD, but mainly it's used for ulcer prophylaxis, especially in the hospital due to the hospital-related stress. So guys, nearly everyone in med-surg usually gets put on a PPI. So when a patient asks, why am I on this med since I usually don't take this at home? Guys, the key word here is it helps prevent the development of an ulcer due to the stress of surgery or hospital stays. Now, it works by reducing the gastric acid by inhibiting the proton pump in the parietal cells of the stomach. And once again, for reinforcement here, long-term side effects. P for porous bones. Again, guys, write this down. Regular bone density test. It increases the risk for osteoporosis with long-term use, increasing the risk for fractures on the spine, wrist, and hip. So guys, always take calcium and vitamin D. And lastly, P for possible C. diff infections, since it suppresses the normal HCl in the stomach, which would normally control the intestinal bacteria. And the last key point is we take 30 minutes before meals, which goes for H2 blockers as well as these PPIs. Now for mucosal protectants, we have 2 here. So first up is sucralfate. Brand name is Carafate, given to treat and prevent both stomach and duodenal or duodenal ulcers in the small intestine. Now, the mode of action. It forms a thick protective layer over the ulcer, which provides a physical barrier against the stomach acids and enzymes. So it's kind of like a band-aid over an open wound. Or you can think it's like filling a pothole in the road. Now, guys, the big key point here is we take on an empty stomach 1 to 2 hours before or after food or meds. So, guys, do not take with any other med. And don't be tricked. Questions ask a lot about taking antacids with this med. Guys, we're avoiding anything and everything. So just think sucralfate 2 hours before or after you ate. And it's best at bedtime. So just think sucralfate, it's better taken late. Now our second mucosal protectant is misoprostol. Now the key tip here is misoprostol, think miscarriage. So guys, it's not for pregnant patients. Now the indication for why it's given. Guys, it's a synthetic prostaglandin to protect against gastric ulcers. So it increases protective mucus inside the stomach. And it's often given to patients on long-term NSAID therapy, like naproxen and ibuprofen, so that they can continue to take those nasty long-term NSAIDs. Now, the major adverse effects here is dysmenorrhea and miscarriage. So it's not for pregnant patients. We always do a pregnancy test before giving this drug. And again, think miscarriage for misoprostol. And the main reason for this is because the drug increases cervical ripening. So on the HESI, the key term was cervical ripening. So guys, for patient education, reliable birth control is a must. If pregnancy is even suspected, then guys, we stop the med and contact the HCP immediately. And lastly, a key point is do not take with any antacids. So guys, don't even let the NCLEX trick you here. Antacids are anti-mixing with any other med at the same time, since it blocks absorption. Activated charcoal is given for initial treatment for salicylate or aspirin toxicity. And sodium bicarb is usually given second. Now guys, not gastric lavage. This is no longer recommended for aspirin overdose. Now the mechanism of action here. Activated charcoal actually binds to aspirin and inhibits the absorption in the small intestine. So for signs and symptoms of aspirin toxicity, we use the ABCs. A for altered mental status with disorientation and restlessness, B for barfing or vomiting, and C for crazy breathing, aka hyperventilation. Now for pancreolipase, guys, let the name help you. Just think pancreas, which releases enzymes to help you break down food, and ACE, the enzyme. So lipase is a fat enzyme to break down fat, protease is a protein enzyme, and amylase is to break down carbs. Now guys, it's given to replace digestive enzymes in patients with cystic fibrosis. And the key point here, write this down, it must be eaten with every single meal or snack, or the med is not effective. So guys, not 30 minutes before, not 1 hour after. The key term here is with meals and snacks. Now Kaplan says for administration, you open the capsule and sprinkle the contents onto applesauce, for example, and instruct the client to swallow the applesauce without chewing. And a HESI question came up. Reduction in fatty stools is an expected outcome. Since the enzymes are breaking down fat in the body, so we just don't see it in the potty. Now for the supplements, we're talking about vitamins and minerals as well as herbs. First up is iron, aka ferrous sulfate when taken orally, and iron dextran when taken IV or IM. Now, it's given to treat anemia related to iron deficiency. It's basically the building blocks for RBCs, those red blood cells. So big patient education key points here. Any dark or black stools, guys, these are normal and to be expected, not a GI bleed. Probably the only case and scenario where it's to be expected. Now, it's taken on an empty stomach 1 hour before the medications. So guys, iron blocks absorption of all meds. So just think that the stomach is like a wrestling mat and iron is like Iron Man. Basically blocks and dominates everything. But here's the trick. Vitamin C actually helps with absorption. But guys, not taken at the same time. So Kaplan and Hesse says which one is a medical error? Well, when calcium is given with ferrous sulfate. Guys, the key term there is with. So, blocks absorption. Another question was ferrous sulfate taken with orange juice and fruit juice to enhance absorption. So guys, yes, you can take it concurrently. And last one is ferrous sulfate. Teaching is effective when the client states, I will eat more fresh fruit and whole grain bread. Yes, guys, good diet. Now, next up is B12. And the tongue twister here is cyanocobalamin. Now, the indication is anemia, but specifically pernicious anemia, where the body lacks intrinsic factors so it can't absorb the building blocks to make RBCs, specifically iron, folic acid, and B12. Now, speaking of folic acid, the indication is for anemia in general, so just basically a low blood cell count. So folic acid, iron, and B12, again, guys, are required for RBC production. And it's also given to alcoholics who lack nutrients. And we also give it to patients on sulfa drugs. For example, sulfalazine. Guys, just remember the F in sulf is F for folic acid supplements. So we supplement with 1 milligram per day. Lastly, pregnancy. It's very healthy for pregnant patients to be taking folate or folic acid. So the Hesse ask, folic acid, it prevents neural tube defects, basically taken before pregnancy. Now next, technically not a vitamin or mineral, but an electrolyte, basically a supplement. Guys, we cover potassium and magnesium extensively in the Fluent Electrolyte course, but here's some tidbits that ATI wants you to know. So potassium, guys, just think it pumps the muscles. And we give potassium, obviously, for low potassium below 3.5. Now, guys, K-wasting diuretics like loops and thiazides, basically ide-ending diuretics like furosemide and hydrochlorothiazide, think that potassium is dried up. Now, guys, it's not for potassium-sparing diuretics. So spironolactone spares the K. And sartans, basically ARBs like losartan, spares the potassium. And ACE inhibitors like prils, like lisinopril, just think P for more potassium. Guys, we don't give it to them. Now, the nursing considerations here, here's the key point. We slow the infusion rate if the infusion irritates the client or reports burning or discomfort. Now, do not stop the infusion for reports of irritation when K is critically low. A lot of students chose that as a distractor. Guys, there's no need to notify the HCP or the doctor. Just slow the infusion here. And continue to monitor hourly the redness, the pain, the swelling, the phlebitis, and basically any type of infiltration. Now, we cover this more extensively inside the electrolyte lectures, so go there if you want to see more. Now, a little side note about potassium. Think potassium pumps the heart. So the 4 rules of potassium revolve around protecting the heart with potassium. Number 1, our first action is heart monitor placement. And secondly, guys, we never push potassium. This means sudden death. The heart will cramp up and not pump anymore. Third, we only do 10 to 20 mLs max per hour. Not 30 minutes, not even 45 minutes, guys, per hour, a full 60 minutes or more, usually around 4 hours. And lastly, we always put potassium on an IV pump. Never a solo drip, guys, it's too risky. And as always, slow the infusion pump if the arm starts burning, which is pretty common. Now, to help you remember the ECG rhythms with high versus low potassium, our memory trick is very simple here. So just think high potassium, we have high pumps. So we get peak T waves and ST elevations for potassium over 5.0. And the exact opposite for low potassium below 3.5, just think low pumps. So we get flat T waves and ST depression and even this weird little U wave. Now for magnesium sulfate, guys, just think magnesium mellows the muscles. Given for wild muscles, guys, that are not mellow. So for example, preterm labor, we have wild contractions. Or anticonvulsants, guys, wild muscles. And even cardiac issues like key term here, torsades de pointes. The HESI and ATI love this one. Guys, that's a wild heartbeat and it's very deadly. So we give mag to mellow out those muscles. So nursing consideration here, guys, big caution. Too much mag means too much mellow. Key term here is respiratory depression. That is the most deadly. We also get paralysis and weak muscles, basically meaning low DTRs, those low reflexes. And guys, the antidote here is calcium gluconate. So just think we need to glue down the muscles if they're getting way too mellow. Now guys, ATI and HESI have 3 common questions here. So HESI says magnesium sulfate, when to stop the infusion? Well guys, we're going to stop it when respiratory rate gets too low, for example, less than 12, or when DTRs are non-existent. We're looking for too mellow, guys, basically a dead patient. And possible findings in a newborn. So if the mom has gotten this magnesium sulfate preterm labor, we're looking for newborn hypotension, flaccid muscle tone, and even respiratory depression. Now, magnesium sulfate in another quiz bank, what is the indication? Guys, we replace it for low mag and treatment for torsades de pointes. If you don't know torsades, and you didn't write that down, guys, that's a huge test tip right there. Now for herbal supplements, the biggest covered section on all the quiz banks is always the most deadly. And right here, the bleed risk is usually the most deadly. So guys, we never mix this with blood thinners like antiplatelets like aspirin and clopidogrel. And we always discontinue before surgery. Big bleed risk there. So acronym is EGO. So guys, just think you have to Lego the ego before surgery. So E is for vitamin E. Then we have the 3 Gs. Ginger, garlic, ginkgo biloba, which is a really big one. And also ginseng. So that little last one snuck right in. And guys, O is for omega-3s. Now, as far as joints, we use glucosamine, which improves joint function in osteoarthritis patients. But guys, we watch for hypoglycemia when taken with other anti-diabetic meds. Now, ATI touched on glucosamine as key term treatment for arthritic pain. Now, for all our herbal supplements, there's a lot of nice things to know, but we're going to focus on the need to know to pass the ATI, HESI, and as well as the NCLEX. So, H for heart, we use hawthorn extract, which treats heart failure as well as hypertension. Now, skin, guys, just think of the E for eczema or skin irritation. We use for E, evening prime rose. And a big one here, guys, prostate. We use sal palmetto. Now, the key point is it uses to treat BPH. So just think SP for sal palmetto treats SP, that swollen prostate. So BPH, that benign prostate hypertrophy. And guys, it's not used for hot flashes. It's a commonly chosen distractor. That would be our black cohosh, used for menopause. And speaking of menopause, guys, hot flashes. Just think black cohosh for black co-hot flashes. The indication is for menopausal hot flashes. Now for nursing care, guys, the key point here to know. Assess for interaction with clients on other meds, and priority is the drug-to-drug interaction. Guys, everything else comes second. Since herbs are usually discontinued during short hospital stays, we stop 2 to 3 weeks prior to surgery. Usually a common trend with all herbal supplements. Now next is for mental, depression and insomnia. V is for valerian root, which sounds kind of like Valium. So just think, it treats anxiety by increasing GABA. And we think that GABA is our grandma. Very soothing, very calming. So valerian calms you down like Valium. Now next is St. John's wort, which affects serotonin. So guys, caution here. Serotonin syndrome is a big risk. So stay away from other antidepressants with St. John worts. Guys, the key point is again here, do not mix. 1, antidepressants. We're talking SSRIs, MAOIs, TCAs, because guys, we're going to fall into serotonin syndrome. And the big signs and symptoms for that are shivering and diarrhea, leading to severe muscle rigidity, fever, and seizures, and then ultimately death. Now, other side effects of St. John's wort that are nice to know, but not really needed to know, is that it decreases the INR with anticoagulants like warfarin with I and R, and also digoxin, which it decreases the effectiveness, and hypertension crisis, so we just monitor the blood pressure regularly. Now, some common chosen distractors here, which are nice to know but not really needed to know. We have kava, which treats anxiety and insomnia. Big side effect is that it's liver toxic. And licorice root, which treats ulcers and infection, but a huge side effect is hypertension, but a big keyword here, hypokalemia, that low potassium. So just think licorice lowers the potassium. All right, guys, that wraps it up for GI and nutrition. Thanks so much for watching.